My name is Molettieri, and this is my case presentation. For my introduction, I chose to do my case presentation on Rue Bennett, who is a 17-year-old female. Rue is biracial, both being Caucasian from her father and African American from her mother, and she was referred by her younger sister and mother after they had caught/found her on the floor of their bathroom looking like she may have overdosed. So some background information. Her date of birth was September 14th, 2001, 3 days after the Twin Towers had been attacked and collapsed. She resides in East Highland, California with her mother, Leslie, and sister, Gia. Her mother and her do not have the best relationship due to Rue's drug use, and this has caused Rue to not go to her mother, and for her mother to be suspicious and untrusting of Rue. Her father, Robert, had died from cancer when Rue was 13 years old. Prior to his death, Rue and her father were extremely close. This is also partly the reason for Rue to have started her drug use, because he was in a lot of pain at the end of his life, taking opioids to relieve the pain, which is how Rue was initially exposed. And then her younger sister, Gia, is a shy and normally keeps to herself. But she was the one who found Rue on the floor after her almost overdose. This also put a strain on their relationship because Gia just wants Rue to get clean. That way she doesn't have to see another family member die and lose another family member. Some biological information. Rue's clothing tends to be a little more casual, including hoodies and baggy t-shirts. She does this so that she can try to go unnoticed most of the time. For physical appearance, she commonly has extremely messy hair, very curly, looking like she didn't really style it, or in a high messy bun, and she does not wear makeup, and this allows us to see the bags under her eyes, showing that she is not getting much sleep or could potentially be on drugs. She also has a constant slouched posture. This is potentially due to her height, since she's so much taller than others at school, and she's trying to go unnoticed. This gives a way of showing her mental health status and confidence levels as well. And the way she presents herself is seen to embody vulnerability and how she navigates the world primarily on her own. And she likes to be alone and will normally cut off those who try to get close to her. For the social aspects, she was in a relationship for a short period with Jules Vagan, who was originally just one of her friends. Jules had an interesting introduction to the show, as she is first introduced when having intercourse with one of the fathers of a fellow student, and Jules is also a transgender woman and bisexual. Some characteristics of their relationship include codependency, deep emotional connection, and some complications. For codependency, both Rue and Jules start the relationship off never wanting to leave each other's side and always leaning on and needing each other. The deep emotional connection is that they instantly clicked since they were first best friends, allowing them to instantly feel closer to one another. And then another one is complications, and due to these other two characteristics of codependency and deep emotional connection, that made this complication even worse. Jules eventually evolved feelings of independence from Rue, causing her to start seeing someone else and breaking up with Rue. And since Rue was so dependent and emotionally connected to Jules, this really put a tear in her mental health and caused her to go down an even darker road. For education, Rue attends East Highland High School, and while they do not exactly say like the grade she's in, she appears to be in her junior or senior year of high school, and during her struggle with mental health and drug use, she had completely stopped going to school and which had impacting her academic performance and attendance severely. She eventually gets suspended at one point of her education due to being caught at school while under the influence of drugs, and this really highlights her struggles with addiction. So for employment and military status, she is not employed and is a full-time high school student, and she has no military history. For legal history, she was once arrested for drug possession, and this was part of her backstory, which put her into rehab the first time. And this is the start of the tension between Rue and her mother, because her mother's just trying to help her keep clean, and Rue does not want that. And then she also has a history of theft. She was caught stealing pills from her mother, participating in drug deals, and breaking into homes and private spaces. So for her psychological symptoms and diagnoses, I use the ICD-10 for many of these. The first one is F33.1, which is major depressive disorder and is recurrent and moderate. This is just because she continues to go into these depressive episodes, and while she's always depressed, it gets worse during many different occasions. The second one was F31, which is bipolar disorder, and it's a major mood disorder characterized by severe mood swings and a tendency to recurrence and remission. So she's constantly changing her moods, which also depends on the drug use, because depending on if she is high or not will impact her mood as well. The next one is F11.222, which is opioid-related disorders, opioid dependence with intoxication with perceptual disturbance. So when she drinks, that's when she's feeling more dependent on opiates, and then she's also changing her perceptions through this. And then the last one is F25.0, which is schizoaffective disorder, which includes schizophrenia and mood disorders, which is depression and bipolar disorder, which is also potentially from the drug use, because she does start seeing things when she starts to see her dad. Lastly, for treatment recommendations, the first part of my treatment would be detoxification and rehabilitation. Since she has such a serious drug problem at a young age, this could also be causing some of her other disorders, such as bipolar disorder and depression disorder. I think it would be important to do this through inpatient rehab, because this can start a structured drug-free environment for 30 to 90 days. I think inpatient is the most important, and the structured drug-free environment is important. That way she's going off a schedule and is less likely to think of drugs. Next is the dual diagnosis treatment, which is used to treat her other symptoms of depression, bipolar disorder, anxiety, etc. The use of medications such as mood stabilizers, and then the use of cognitive behavioral therapy is extremely important here. Next is outpatient therapy. Individual and group therapy are important for her to talk these problems out, and limit going back to the old ways. And group would be important, that way she can see how other people have struggled and will hopefully get to their level. And then lastly, family therapy should be used to rebuild trust in her family between her mother, and her sister. That way they can trust her not to do drugs, and she can trust them to go to them when she does feel like she's in trouble. And then lastly is a relapse prevention plan. Rue needs to be able to lean on her mother and sister for help when she's thinking of relapsing, and continued monitoring and regular drug testing should be used, so Rue doesn't have any reason to go back, and if she knows she's going to be tested, she's less likely to think of doing drugs.